Prostate cancer symptoms often ignored until it's too late. A silent warning. John Miller was a retired firefighter from Ohio. At 64, he still walked his golden retriever through the neighborhood every morning, nodding to the same folks he'd known for decades. He felt healthy, or so he thought. But what he didn't know was that prostate cancer had been quietly growing inside him. When he finally saw a doctor, it had already spread. This story isn't unique. Every year, thousands of men in America find out too late that they have prostate cancer. One of the biggest challenges with this disease is that its early signs are often brushed off or misunderstood. In this document, we'll walk you through 10 commonly ignored symptoms of prostate cancer. Each symptom is more than just a physical signal, it tells a story. As we explore them, we hope to raise awareness, encourage early detection, and perhaps save a few lives along the way. 1. Frequent urination, especially at night. Tom Anderson, a 58-year-old accountant from Minneapolis, thought it was just age catching up with him. He found himself waking up 2 or 3 times a night to urinate. It was annoying, sure, but he figured it was normal. What Tom didn't know was that this small disruption was a whisper from his prostate. The prostate sits just below the bladder and surrounds the urethra. When it enlarges, whether from cancer or benign growth, it can press on the urethra and interfere with urine flow. Waking up at night, a condition called nocturia, may seem harmless, but it can be one of the first warning signs. Many men chalk it up to aging or increased fluid intake before bed. But if it becomes persistent, it's a signal worth listening to. It's about patterns, not panic. If your sleep is frequently interrupted, especially more than twice a night, talk to your doctor. Like Tom, you might discover there's more to the story than just a weak bladder too. Difficulty starting urination. James Brooks was a Vietnam veteran and a patient man, but over the past few months, he noticed something peculiar. Every time he went to the bathroom, he had to stand there, waiting. The stream wouldn't start right away. Sometimes it felt like he had to concentrate just to get things going. This is another early, overlooked symptom. Prostate cancer can grow in such a way that it presses against the urethra, creating a blockage or resistance. That difficulty in starting urination, even if there's no pain or other symptoms, can indicate changes in the prostate. For James, it took a conversation with his daughter, a nurse, to push him toward a checkup. That visit may have saved his life. When your body hesitates, it's often a form of communication. Listening matters. 3. Weak or interrupted urine stream. David Reynolds, a 61-year-old farmer from Kansas, described it like this: "It felt like a garden hose with low pressure. 1 minute there's a stream, the next it's a dribble." This might sound like an inconvenience more than a threat, but it can be a sign of something more serious. When the prostate grows, it can pinch the urethra, causing the flow of urine to weaken or stop unexpectedly. Intermittent flow is particularly easy to ignore. You might assume it's dehydration, or that you simply waited too long. But if this becomes a regular occurrence, it may be time to look beyond the surface. David was lucky his wife insisted he see their family doctor. The diagnosis was early-stage prostate cancer, for a pain or burning sensation during urination. Michael Torres, a retired Navy engineer living in Florida, never thought much of the sting he sometimes felt when peeing. He assumed it was from not drinking enough water or maybe a mild infection. But when the pain became more frequent and drinking water didn't help, he mentioned it at a routine physical. That small detail changed everything. Pain or burning during urination is often attributed to urinary tract infections (UTIs), which are less common in men than women. When they do appear, especially without other infection signs, it might be the result of inflammation from cancerous changes in the prostate. Michael's early complaint led to testing that revealed prostate cancer at a treatable stage. It taught him, and those around him, never to underestimate discomfort. 5. Blood in urine or semen. Stephen Walker, a 66-year-old former school principal, never expected to see red in his urine. It shocked him. He told his wife, who urged him to get checked immediately. Hematuria, blood in urine, or hematospermia, blood in semen, can be alarming, and for good reason. These are often signs of trauma, infection, or in some cases, prostate cancer. Blood indicates that something is disrupting the tissue or blood vessels within the urinary or reproductive tract. While not every case of blood means cancer, it always warrants medical evaluation. Stephen's story reminds us that visible signs should never be brushed aside, especially when they come from parts of the body we're hesitant to talk about. 6. Erectile dysfunction. Ronald Pierce was a 60-year-old high school basketball coach from Georgia. Fit, energetic, and devoted to his wife, he found it troubling when he began to struggle with erections. At first, he blamed stress and age. Then came the embarrassment and avoidance. What Ronald didn't realize was that prostate cancer can directly affect nerves and blood flow involved in sexual function. Tumors, inflammation, or treatments like radiation and surgery may impair erectile performance. But even before treatment, the cancer itself may interfere. Ronald's delay in seeking help came from pride, a common barrier. But once he opened up to his doctor, tests revealed cancer that was still treatable. Erectile dysfunction isn't just about intimacy. For some, it's the first sign that something deeper is going wrong. Sometimes, the body's most private struggles are its most urgent cries for help. 7. Pain in the lower back, hips, or thighs. Mark Jenkins, a 63-year-old retired mechanic, thought the dull ache in his lower back was just from years of physical work. He ignored it for months. But when it spread to his hips and thighs, his wife insisted he see a doctor. Prostate cancer that has spread often targets bones, especially in the spine, hips, or upper legs. Persistent pain in these areas, especially when unrelated to known injuries or strains, should not be ignored. Mark's backache turned out to be a symptom of advanced cancer. While frightening, his story emphasizes the importance of taking new, unexplained pain seriously, especially in older men. 8. Unexplained weight loss. Dennis Crawford, a 67-year-old retired truck driver, thought he was finally losing his stubborn belly fat. Over a few months, he dropped nearly 20 pounds without dieting or exercise. His wife, however, grew concerned. Unexplained weight loss can be a subtle but serious warning sign. When cancer advances, it often changes how the body uses energy, leading to sudden weight loss, fatigue, and weakness. It's not just about aesthetics, it's about a hidden illness silently draining the body. Dennis's weight loss led him to a doctor's office, where blood tests and scans confirmed advanced prostate cancer. It was a wake-up call for him and his circle of friends who had also brushed off changes in weight as harmless. 9. Fatigue or weakness without cause. Jerry Simmons, a 59-year-old warehouse supervisor, began feeling exhausted even after a good night's sleep. He had trouble finishing routine tasks and often found himself needing naps in the middle of the day. Fatigue is easy to ignore. We blame age, stress, poor sleep, or diet. But in some cases, it's your body's way of signaling that something serious is happening internally. Prostate cancer, especially when it spreads, can cause chronic fatigue due to the body's immune response or anemia from cancer affecting the bone marrow. For Jerry, the persistent fatigue was the only clue. And fortunately, he paid attention. Early testing led to a diagnosis, giving him time and options. 10. Loss of bladder or bowel control. Lloyd Patterson, 65, experienced sudden episodes where he couldn't make it to the bathroom in time. At first, he was too embarrassed to say anything, but the episodes kept happening, sometimes at work, sometimes at home. Finally, he opened up to his doctor. Loss of bladder or bowel control, while often associated with other conditions, can also signal prostate cancer that has spread and is pressing on the spinal cord or nerves in the lower back. It's a late-stage symptom, but one that needs immediate medical attention. Lloyd's courage in speaking up helped get him a diagnosis and treatment plan that focused on both managing symptoms and slowing the cancer's progression. Final thoughts. The power of awareness. Prostate cancer doesn't always shout. Sometimes it whispers through fatigue, subtle discomfort, or minor changes we overlook. The stories in this guide are fictionalized composites based on real symptoms and outcomes. Their purpose is to empower, not alarm. If you're experiencing any of these signs, don't ignore them. Talk to your doctor. Early detection is not just about better outcomes, it's about preserving quality of life. Awareness can save lives, maybe even yours.